Welcome back, everyone. It's wonderful to be back with all of you. We begin this semester at a difficult time. We're currently living in the most challenging moment of the pandemic. A year ago this week, the first confirmed case of the novel coronavirus was identified in the United States in Washington State. And we're profoundly aware of the devastating impact of this virus over this past year. A week ago, we rang the bells of Healy Hall 400 times in memory of the 400,000 Americans who were lost to COVID-19. As we enter this new year, we are watching closely the national landscape and the information being shared by our government and public health leaders.
Unfortunately, we're experiencing a substantial surge across the nation, where we now have really a significant number of our jurisdictions and states that are really in what we call the red zone. A wide surge that happened in the heartland and the northern plains, which really lasted a lot longer than, say, what we had with the spring and summer surge. The other thing, it had a much more steep trajectory. So when you looked at the spring surge, this was sort of the rate of increase, and the summer surge. And when we looked at this more recent surge, this is really more what the rate of increase is. So right now, it is so important that we recommit ourselves to this mitigation as we now begin to turn the corner with the vaccine. But the reality is December and January and February are going to be rough times. I actually believe they're going to be the most difficult time in the public health history of this nation, largely because of the stress that it's going to put on our healthcare system.
We want to go now to the incoming Biden administration's CDC director. That's Dr. Rochelle Wallensky. She is also the chief of infectious diseases at Massachusetts General Hospital. She joins us from Boston. Good morning to you, doctor.
Good morning, Margaret. Thanks for having me.
We are already at 4,000 cases a day. The outgoing CDC director, deaths a day, the outgoing CDC director says we're about to be in the worst months. Do you agree with his forecast that it's going to get worse?
Unfortunately, I do. I think that, we've, as you noted, nearly 4,000 deaths a day, almost 400,000 deaths total by the middle of February. We expect 500,000 deaths in this country. That doesn't speak to the tens of thousands of people who are living with a yet uncharacterized syndrome after they've recovered. And we still yet haven't seen the ramifications of what happened from the holiday travel, from holiday gathering, in terms of high rates of hospitalizations and the deaths thereafter. So yes, I think we still have some dark weeks ahead.
We're living in the most challenging moment of the pandemic. And we're living in the most hopeful moment in the pandemic. With the vaccine now being distributed, we have the possibility of putting in place the conditions that will enable us to return to normalcy, for us to welcome everyone back to campus. What I'd like to do now is review our framework as we begin the spring semester. There are 3 priorities guiding our work. These 3 priorities have guided our work since March. First, to protect the health and safety of the members of our community. We want to bring 26,000 people through this pandemic, students, staff, and faculty. And we want to protect our surrounding community, home to 15,000 people. Second, we want to ensure academic continuity and fulfill our educational and research missions. And third, we want to protect the livelihoods of the members of our community during a very difficult time. We have seen historic levels of unemployment, as high as 15% last April. Today, nearly 10% of Black and Latino workers are unemployed. 6% of white workers. Those without a college degree have faced greater losses than those with college degrees. through extraordinary measures, we have been able to protect our workforce here at Georgetown. There are three characteristics of this pandemic that have made it very challenging and continue to do so. First, exponential spread. Once cases start to spread, it can become uncontrolled. Infection surges. The speed at which cases spread grows. And when we see a rise in cases, we see a rise in hospitalizations, and following a rise in hospitalizations, we see a rise in deaths. Public health measures, from mask wearing to physical distancing, testing, isolation, and quarantine, ultimately a vaccine, are necessary to break the chain of transmission and to mitigate spread. But the exponential spread of this virus has been confounding. Second is asymptomatic spread. We know that 40% of all cases, it may be as high as 50% of all cases are spread asymptomatically. That is, the person spreading the virus may not be aware that they are even doing so. We need to learn more about how this spread occurs. And then there are uncertainties that have been confounding since the beginning of this pandemic. Two uncertainties that we face at this moment. First, the phenomenon of the super spreader. This captures the dispersion, the pervasiveness. It appears that smaller numbers of people are responsible for greater transmission, and we don't know why. And second, the most immediate, the new variants, new strains of the virus. It appears that they could significantly increase the rate of transmission, the spread of the virus. Now, our approach in developing our public health program is captured in the graphic that I have shared with you on other occasions. The Swiss cheese model, layer upon layer. And we've added layers as we have moved along over these months, including ventilation, when we began to understand that the virus was spread through aerosols, very small particles. And as we began offering hybrids last fall as pilots, we recognized that ventilation was going to be crucial. And the most recent layer that we've added is vaccination. A word about vaccines. 2 are approved under emergency use authorization in the United States: Moderna and the Pfizer-BioNTech vaccines. 2 more are expected to seek emergency use approval very shortly: AstraZeneca and Johnson & Johnson. We operate under the DC Department of Health for vaccine distribution, and DC Health has outlined a phased approach, beginning with those in emergency and healthcare services, those over 65, and certain high-risk populations. We have a new vaccine working group here on campus that is closely monitoring and preparing for how we can bring the vaccine to the members of our community. For now, even those who have received the vaccine should continue to adhere to public health guidelines: mask wearing, testing, physical distancing. Last summer, I shared with you a set of practical assumptions that guide us in our work. These practical assumptions continue to support our efforts here at Georgetown. Our third practical assumption focuses on the timing of medical advances. And all of us are benefiting from extraordinary work done over the past 11 months by our global scientific community to understand, treat, and prevent the virus. We can feel hopeful for a return to normalcy in the coming months because of their work. We now begin the spring semester. Classes on our main campus start today. There are key elements to any campus return, and I'd like to focus on three: modality, residential density, and testing. Modality. We are operating in a primarily virtual environment, consistent with our peers, with some hybrid elements. Regarding residential density, for the spring, we have focused primarily on our senior undergraduate students and a limited number of students with specific academic or personal circumstances. And regarding testing, well, regular asymptomatic testing twice a week continues to be our practice. As the vaccine distribution advances and public health guidelines are updated, we will reevaluate our testing protocols. We have recently announced new measures to support our students, our faculty, and staff during this time. For our students, our counseling and psychiatric service, CAPS, transitioned to a telehealth model last spring, and we've now augmented our CAPS resources with a new 24-hour, 7-day-a-week telehealth service for mental health at no cost to our students. For our faculty and staff, we developed a program with One Medical, and we rolled that out just before the holidays. We've launched our WeWork partnership for our students to access quiet study space. And some on-campus study spaces are also opening for those on campus. And we will soon be sharing more information on our summer residential program that we will be offering for our first-year students as they transition into their sophomore year. As I said at the opening, we are currently living in the most challenging moment of the pandemic, and we are living in the most hopeful moment in the pandemic. As we enter this new semester and the hope and challenges that it brings for us, we are resolute in our care and support for one another, in our commitment to the health and safety of our friends and colleagues, families, neighbors, and our broader community. It is a privilege to be able to share this moment with you and to offer these reflections as our community continues to navigate our way through this pandemic. I look forward to being with all of you again next week and wish you all the very best as we start this new semester. Take care of yourselves and take care of everyone around you. For every Hoya, everywhere.